Hi everyone, thanks so much for joining the webinar today. I just want to note that everyone will be muted to help with sound. And if you have any questions throughout the webinar, please post them in the questions box on the bottom of your screen there, and we will take some time at the end of the webinar to answer any of those questions. And without any further ado, I'd like to introduce Christine Diggins, who will be presenting the webinar today. Christine?
Absolutely. Well, thank you, and it's a privilege to be here with you virtually today to present on such an important topic. So, as was mentioned, my name is Christine Diggins. I have been, a little bit about myself, I've been working in primary care for 8 years now, and particularly in internal medicine, family practice, and now in the last couple of years in retail health. So I think this topic is of importance to all of us that are in primary care, specifically as we look at the type of conditions that come in on a day-to-day basis and really understanding the safe acetaminophen use for our patients. So I'm going to go ahead and switch the slide if you're following along online. We're looking at some of the learning objectives that we want to have for today's presentation. And again, I thank you for your time. It's always a privilege to be able to work together, and particularly as we look at an important topic like this. And before I'm waiting on the slide here, I just want to mention some of the cases that have really intrigued me and made me interested in this topic, particularly when I think about acute care and the definite, this time of year when we see so many sore throats and flu and different conditions that there's an acuity in nature where we're trying to provide an analgesic. And a lot of the questions that come to us about acetaminophen and the appropriate analgesic that we want to use can definitely be confounding, and I think it's really important for us as providers to be able to work with our patients and learn together about what works best for them. So hopefully you will find this helpful for you, particularly when you think about the acuity of your presentations at your place of employment where you take care of your patients, and particularly as you want to provide an analgesic for your patients. So it is my goal that at the end of this presentation you will feel comfortable understanding or being able to describe the effective use of acetaminophen. I think many of us have questions about that, especially with a lot of the publicity that has in the last couple of years come out about acetaminophen, and understanding its appropriate use and effective use. Second would be to discuss specific issues surrounding the labeling changes. So what do these mean for me and my patients, and how they impact our patients, particularly in primary care and also in retail health as well. And then finally, what we do best, which is hopefully effectively communicate with our patients about the importance of following the dosage recommendations. And I think one of the most important ways to think about this is information therapy. So it's our goal as clinicians that we are informing our patients, that they are leaving our place, our clinic, understanding and informed about how to use such an important drug as an analgesic and symptom relief. So as you probably are aware, in the past few years, the FDA has advocated for changes to the labeling and packaging of over-the-counter acetaminophen. And the purpose of this is to better inform consumers about liver toxicity. We think it's important for us as clinicians to understand that this is a very important drug in our armoire for helping our patients with acute conditions, but it's also very important for us to understand the safe use of it. So the FDA has included these changes. One is a prominent display of the ingredient acetaminophen on the container and the outer carton. Second would be warnings on any acetaminophen product label about the potential for liver toxicity. So hopefully you've seen these changes already taking place, but we're just reviewing what this means for us as clinicians. And third, warning to consumers against using more than the recommended daily dosage. So I think this is probably true for many of the medications that we use, whether they're over-the-counter or prescription medications. It's understanding what the safe use is of that particular medication. And as I mentioned, as a clinician, when the information about acetaminophen was being publicized, it was very important for me to understand how to use this drug in a safe way, but also to make sure that my patients understand that. I don't think it would be surprised to any of you to know that there are 600 different medications over the counter that have acetaminophen. So it's no wonder that there has been so much confusion and overdosing of the medication. And what we're seeing and what we know to be true is that our patients will often take up different medications with acetaminophen and inadvertently not be aware of how much of this drug that they're getting in their system. So that works out to be about 5,000 Americans per minute that are taking acetaminophen. And when we look at that, it's definitely staggering to think about how much of an impact this can have on our patients. So we want to make sure, first and foremost, with the labeling changes that have taken place with the FDA, that our patients understand how important it is to read labels. And, you know, I think about the fact that as clinicians, we're known as prescribers. So we often focus a lot of our attention on what is prescriptive to our patients. But I think that the important point with acetaminophen is we now have the opportunity to focus our attention on over-the-counter and become more informed with our patients about over-the-counter medications. And, you know, most over-the-counter medications started as prescriptions. So it is pertinent to us and our patients to be informed and counsel our patients and educate them on the importance of reading the labels and understanding how to use each product. And if there's anything that you take from today's webinar, it's hopefully being able to educate your patients on this and reading the labels and not to use a drug in conjunction with another that has acetaminophen. Now that might sound like it, you know, it sounds to reason that we wouldn't be doing that, but just as an example, APAP is the nickname that acetaminophen, as you probably know, has in prescription drugs. And there was confusion about the fact that patients are getting prescription drugs with APAP and then also going over the counter and buying that as well. So there have been some initiatives to make sure that acetaminophen is spelled out very clearly on prescription medications as well. And as I mentioned, the fact that it's in 600 over-the-counter meds really compounds the importance of patients being informed. And the one highlight that I did want to make about liver toxicity is that obviously, like any other medication, you want to make sure that you take a history on the patient's alcohol use. So I want any patient that sees me to know that if they're taking if they're consuming 3 or more alcoholic drinks per day, then it really is safe to consider the fact that their liver is taxed with that. And so if you add the high dose acetaminophen, you are going to have more of a risk with that patient. So if, you know, I always say, let's make sure that that patient is informed because it's over the counter, that if they are taking in and consuming 3 or more alcoholic drinks per day, then they need to know that their risk is higher for toxicity. And I think that it's pretty easy to do this with each patient encounter that we have, so that when we take a medical history, when we take a medication history, an allergy history, we have that opportunity to say to our patients, hey, are you consuming this many alcoholic drinks? In which case, then I would advise to be careful and to avoid acetaminophen. And I think that that's the most important contraindication in understanding that they need to be advised on how much they're taking. But other than that, one of the interesting findings that I've had in reviewing this is that acetaminophen is an excellent choice for our patients with kidney failure, so comorbidities, our patients with a lot of aches and pains, but also having diabetes and hypertension, and just understanding that there is an important place for acetaminophen as an analgesic. And like I mentioned, any other drug, we want to make sure that our patients understand and our adult patients understand that there's a place for this, and particularly just reading the labels. So as you know, excessive acetaminophen does overload the liver's ability to process the drug, and that's why we ask our patients who consume 3 or more alcoholic beverages to be aware of this risk. But then importantly, we have the opportunity and the perfect setting to educate each and every patient that walks in the door. You know, when you think about the fact that there's 5,000 people per minute that could be using acetaminophen, this is probably one of the most transformative education pieces that we can have with our patients.
I'll be in tomorrow.
Because no matter what area that you work in, you have most likely encountering patients who are taking this drug. And so it's the most important impact you can have is recognizing that they are taking it and how to use it in a safe and effective way. So what happens with overdose is obviously the fact that your liver cannot process and eliminate, and it starts to cause damage to the liver. So we're going to look at what those doses are, but that's probably the most concerning aspect that has made a lot of publicity is, you know, this particular piece of acetaminophen use is the liver damage. And it's very unusual for that to happen if the patient is informed and is understanding what they're taking and what medications they're taking. So I think of that patient that comes into the clinic and they have the flu this time of year and, you know, decide that what they need, what you decide what they need is symptom relief more than anything. So they go to the local pharmacy and pick up 3 or 4 medications for their symptom relief. Inadvertently, those 3 or 4 medications have acetaminophen and they end up overdosing themselves. So that's why I keep mentioning the fact that there are 600 drugs over the counter that have acetaminophen. And this is probably the most important information that we can give our patients. So what do people use acetaminophen for? Obviously pain, fever, aches and pains. I think of arthritic pain. It is one of the most effective agents for pain relief. And as I mentioned, it has a special place for our patients with kidney conditions. And oftentimes NSAIDs, non-steroidal anti-inflammatories, are contraindicated. So this is the drug of choice, and it is an effective drug of choice, but like any medication, needs to be properly used and informed for our patients. So I'm thinking of the adult patient who comes in and is asking, okay, what type of, how much acetaminophen should I be on? And you know, this is a trial and error. This is where you work with a patient if they've never had Tylenol, acetaminophen use before. You're looking at the fact that it comes in 325 as a regular strength, 500 as extra strength, and of course 650 as extended relief. And understanding that you know, that straight out drug is an option that they have. But then again, if they buy a medication that has acetaminophen, they have to include that as well. So I would say you don't start with the maximum, but you, like any other drug, you work and see and you titrate according to what's going to work for that patient. For those that have an overdose of acetaminophen, it's important to know that so if they have a risk of it, you obviously want to notify the patient of the signs and symptoms of liver damage. They're not necessarily evident right away. So what would those signs and symptoms be? If you're not aware of those, loss of appetite, nausea, vomiting, and these symptoms can be mistaken for the flu and like symptoms of the flu. So eventually you start to see the signs of liver, when the liver is really failing, which is yellow skin, eyes, dark urine, light-colored stools. And then, of course, you have the mental confusion aspect. Now, it's my hope that your patients wouldn't get to this point after having the education with you and understanding about the risks, but like any medication, we want our patients to know from the very onset, this is what you need to be looking out for. This is what you need to understand is a risk. But ultimately, this is how to safely use this medication. And, you know, it is such an important drug that there has been several campaigns that have started to help educate and to work with you to help educate your patients. So the first and foremost that I mentioned is Know Your Dose campaign, and that's a coalition, and it's basically a group of clinicians and organizations getting together and providing educational materials for us as clinicians, healthcare providers. I went on the website and found a lot of useful information. So you see here www.knowyourdose.org. And all the information is free to providers, but I think you might find some very important information that would help you in your practice. I do want to highlight that it's exciting to think about how we can work with our pharmacists and the local other providers that we work with to make sure that together we're educating, because it's not very helpful to a patient if we do this education and then are not working as a team to do this together with the others who are going to be touch points for our patient care. There's a lot of evidence and research about teamwork in patient care, and I think this is one of those opportunities, particularly where we can see that working together for such a common drug, over-the-counter as well as prescriptive, such a common drug, that we can work with our collaborating clinicians and teamwork to say, let's make sure that our patients know when they leave each one of our individual settings how to know their dose particularly. So what do those messages to patients look like? And, you know, I think that it's important to understand that it's all about reading the label directions. And I think we take that for granted. We're such a high-paced society that, you know, sometimes it's easy to overlook the fact that this information is right on the label. So it might be worth your while to go over that with your patient and say, let's just, you know, I have a sample over-the-counter acetaminophen. Read the directions and let's talk through each one of these. Let's see, okay, what does this mean, the dose, how much to take this, and in reading where I would find acetaminophen. As I mentioned, it is spelled out, so the entire word is spelled out in the consumer-facing materials. And, you know, we want to make sure that when our patients start stacking up their basket full of analgesics, that they're looking to see, okay, does this product have that? And that they understand, if I get 2 products that have it, I should only be taking one of them at a time, never 2 simultaneously. I'm happy to mention as well the McNeil Initiative, which is the Tylenol brand of acetaminophen, has developed a new initiative called Get Relief Responsibly. So I mentioned in Know Your Dose and then Get Relief Responsibly. And that, you know, the campaign is exactly what it's saying here, and that is we are educating patients about how the medications over the counter can be responsibly used. And you know, you can use this as a segue for other medications as well, and understanding how to use over the counter medications. One thing that I read recently is that a lot of prescription drugs are going over the counter faster than previously, and there is more and more opportunity for us to work with our patients. And like I said in the beginning, I think that it's really easy to just consider the fact that as prescribers, we own prescription medication. But I think what's happening in the transition that's happening is that as prescribers, we are also very, very much the bridge to understanding over-the-counter medication. And this is the starting point. It really is the starting point for us to work with our patients on that. And so the McNeil Initiative has the Get Relief Responsibly opportunity, and what it is exactly what I had mentioned earlier. It's an opportunity for clinicians, wherever you practice, whatever your practice role is, to teach your patients how to read the label. And you know, you can't take too much time doing this. So when I think about health literacy and the fact that we often have patients who might not be able to have much understanding of a prescription label or an over-the-counter label, you can highlight those areas that they need to really understand carefully. And you would be surprised at how effective that time with them can be. And then when they go out and go to purchase these medications and have a real sense of ownership of what they're taking, they are then able oftentimes to circumvent prescription medications that might be even more contraindicated for other conditions that they have. So as you inform them, as they become able to understand how to use acetaminophen, there's a very good chance that you're helping your patients be able to avoid prescription medications. And so I want to make sure and just share some important key components that I've learned. I think case studies are the most valuable way for us to learn. So first and foremost, want to highlight the fact that you have important reference materials and available resources that are free to you wherever you are if you have access to the internet, as well as libraries giving you this information. But I want to think about the patient that comes in that is the average American patient that we have in today's day and age with 2 or 3 comorbidities, so let's say hypertensive, middle-aged American, diabetic, right? And let's just say that both of those conditions are not well controlled. And then what brings the patient to the office is often something that's not even related to the cardiovascular risk that that patient has. So we look at hypertension, we look at the diabetes, and then they are coming because they're in pain. So whether that's arthritic pain, oftentimes it's chronic pain, fibromyalgia, different conditions that cause pain that are chronic in nature. And the patient is much more interested in getting that pain resolved than they are the comorbidity. So you're going to be doing your patient such a service to first and foremost focus on how to use acetaminophen effectively, and then as they see their pain relief, they are then more apt to work with you to see the asymptomatic conditions, such as, like I mentioned, the diabetes and hypertension, to see that controlled. So that middle-aged patient that comes in with an A1C that's elevated and the hypertensive and they're complaining of arthritic pain, if you get them to understand the value of acetaminophen, right, so how to take it. So what would we do? We would say, let's make sure that you understand how to read the label here. Do not take more than the recommended dose. Don't take more than 1 product. And, in this case, I would say you can start with the regular dose of acetaminophen, which I mentioned has the 500 milligrams. And we want to make sure that you don't take more than 4,000 milligrams per day. But I wouldn't start the patient right on that. So in the case that I'm reviewing, I would do 3,000 milligrams per day, and then I would have the patient come back in 2 weeks. But one thing I found is that as the medication relieves their pain, the patient is empowered again and empowered to control their other medical conditions. So you have just paved the way for trust, and you have paved the way for managing the chronic conditions that are a risk to their cardiovascular health. And as I mentioned, acetaminophen is safe for use in our patients with kidney failure, or, a lot of our diabetic patients are on the road to basically chronic kidney disease. So I would think that this would be a really good place to start to make sure that the patient's pain is relieved with something that's safe, such as acetaminophen, and that they are educated and informed. I think about the general focus of healthcare today as we go into 2015. The most important focus that I sense across all fields of practice is educating patients and making sure that our patients, their conditions are getting so complex that they have to be able to understand how to manage their own conditions. And I think this is, as I mentioned, the perfect opportunity and segue for that to happen. And if you start by addressing the chief complaint, which oftentimes in primary care the chief complaint is related to pain in some capacity or another, then you are going to earn the patient's trust to take care and own their other conditions as well. And I think it's easy as clinicians to see the chronic disease indicators as the most important to address. But if we don't address the pain that the patient presents with, and we don't address what really is bringing the patient to our practice, then we will lose them and the opportunity to help them manage their chronic diseases. So I think that that's a window of opportunity, and I think that one of the ways that we can recapture acetaminophen understanding, effective use in practice, is to really help tailor the use of acetaminophen effectively. And I would say that in practice it's really easy to start going towards NSAIDs because of some of the publicity, but then what we end up doing is risking our patients' health in other ways because NSAIDs present their own risk as well, right? And so we know that enabling our patients to have pain relief is important, and we can't just choose one over the other. Taking the individual case, looking at each individual case and recognizing, okay, what are the risks that you have, and how can I work with you to make sure that I am addressing your risks, and what's best for you. So just some of the over-the-counter medications that you might know off the top of your head that have acetaminophen, Alka-Seltzer Plus, Contact Cold and Flu, just some of these equate arthritis medications, Mucinex, and I just throw these out there because even Vicodin, because sometimes it's easy for us as clinicians to not be aware of how many, and I can't say that enough, that there are so many, and so looking under drug facts and understanding how to read active ingredient, and you can highlight that if you have the actual bottle with you, an example bottle that you can use with your patient and show them, okay, this has so many milligrams, and it says to use it in such and such a way, and this is how you would take that, and making sure that before they leave, they can repeat that back to you. And that really is what the Acetaminophen Awareness Coalition is all about, is making sure that our patients know their dose. And one of the exciting components about this is how many people have become aware of this and have started making informed decisions about how to use this important drug and how to take ownership of their own pain. But we still have work to do, and we still have an opportunity with each and every patient encounter to work with our patients. Like I said, I'm happy to say that the prescription drugs that do have acetaminophen spell out that drug completely so that it says on there, this is the medication that you're taking, and as the patient becomes aware of that, they can read both their prescription and over-the-counter medication. And, as we think about this, in conclusion, one of the things that I think is so important is to understand, why is it that a patient would be led to overdose or impulsive overdosing? And the research really clearly shows that, as I looked at the evidence here, why is it that patients might be doing this and taking more than they maybe should, is there is an interest in our patients to have, no surprise to us, but to have immediate relief of pain, right? So one of the things that ends up happening regardless of the prescription is that patients will take the maximum dose immediately, and it's known as impulsive overdosing. So some of the conditions that this happens with, it's chronic back pain, headache, fibromyalgia, rheumatologic pain, and that impulsive overdosing is where we start to get in trouble. And our patients particularly are unaware that, since it's over the counter, I think there's this assumption that it's safe to take as much as I want. And I think as patients know, okay, 4 milligrams is the most that I would ever want to be taking in a day, but I don't have to start on that high dose regimen working with the medication that I pick up, whether it's over the counter or prescription, and calculating exactly what I need, and then titrating it according to what's going to work. I'm happy to say that education of patients is working, and that patients are recognizing that there was a study done in 2010, 78% of our patients understood that overdosing of acetaminophen could lead to liver damage, and now 87% in 2013 responded that they did understand that. So I think that there's definitely progress that's happening, and it's exciting to think that our patients are label reading, they're understanding the labels and how to read them, they're following the dosing instructions, they're understanding the awareness of the risk, and they're avoiding doubling up on medication. So I think that we can, we will lose our audience if we take this focus away, so continue to focus on this, but then ultimately seeing this opportunity in our chronic disease state in the United States in 2015 as an opportunity to gain our patient trust through caring about their chief complaint, which is often pain, educating them on proper acetaminophen use, and then through that venue, being able to help patients manage their chronic diseases. Because what brings them to the office, what brings them to the exam room is symptoms, and symptom relief is the most important to gain their trust in adoption of asymptomatic conditions, which are often those cardiovascular risks that we see. So just as a summary, always read and follow the medicine label. Know what medications that you're taking or you've been prescribed to have acetaminophen. And as a patient, that's so important if you're going to several different clinicians. And as clinicians, we can work together to really provide a cohesive approach. But making sure our patients know to look at all the medications they've been prescribed or taken. And then obviously to ask a pharmacist or a healthcare professional if they have questions. And I like to work very closely with my patients and say, bring your medications with you on every visit. So let me look at what you're taking. And it's easy to have patients focus on what they have as prescription drugs. So they'll bring their prescription drugs, and then as we're talking, I'll say, well, what about your over-the-counter medications? And that's where oftentimes patients don't realize that that's something that they can really bring to you, and you can look at the prescription and over-counter together. And I think that's definitely becoming a focus of primary care, is pharmaceutical counseling, and it's exciting to think about the opportunities that we have there, as so many patients are on a polypharmacy regimen, 5 or more medicines, and here you have the chance to look at what are they taking, herbal supplements, over-the-counter meds, and then, of course, their prescription medicine. And you might be the one to find that they are being prescribed acetaminophen as well as taking over-the-counter acetaminophen. And in looking at the research, since this has become such a focus over the last 2 years, the safe messages about acetaminophen have been seen by consumers a billion times. So there's definitely been a lot of information about this. And I think it just comes back to our ownership as clinicians, whatever area that you work in, being able to partner with Get Relief Responsibly, Know Your Dose, and you do not have to do the work. It's already been done for you. What is left to us is to educate our patients. And I always think about how important it is to do that one patient at a time. We can never assume that because we educated the patient, previous patient, that the coming in patient at the time understands. Each and every patient has a unique opportunity to learn about this and have enhanced visibility of these labeling changes, and understanding that there is a very important place for this analgesic in your care. And if, like I said, if you're anything like me and you're working in primary care and you see patients with chronic kidney disease, there's definitely an opportunity here to continue to use this in a safe way that brings relief and pain relief to patients. And it's no surprise to find out that education is working, education is effective, and I think about the various roles of the primary care provider, particularly in how we, with each and every patient encounter, whether or not they have the chronic diseases, as I mentioned, the adult patient that comes in is definitely looking for symptom relief. And particularly this time of year, which was a great time for us to have this webinar, to think about the flu season, sore throat, sinus infection, and the value of providing safe and effective symptom relief to our patients is just really invaluable. So I know that there's some really focused information in this deck and in this presentation particularly, and although it may seem like it's something that's redundant, I think the important point and the take-home for all of us is just how important it is to keep doing what we're doing and educating our patients. And I'm going to ask, I'm not sure if there have been any questions that have been typed in.
Christine, we actually do have a question.
Okay.
Question is, do you have any recommendations about patient education for children or teen populations? And the second part of the question is, do you have any different approaches for educating younger populations about acetaminophen?
So I appreciate that question, and when I was doing this research for this presentation, I found a lot of different materials based on the patient population. So it definitely does depend, is the patient population that you're working with, is there literacy, is it children and adults? There's definitely a difference. So I would say use the two resources that were mentioned, Know Your Dose and Get Relief Responsibly. They have a lot of tools on there. When I was on there specifically for children, because I think that is, obviously this presentation was focused on adults, but the child dosing of acetaminophen for, that mother that's trying to get the fever down and really making sure that she's dosing appropriately, there's some really good tools on there. And, it just comes back to reading the labels appropriately. And then I did find that they had a different tool based on the patient's literacy. And so, you can look at it and download these free resources and see, is this something that would work for my patient who maybe struggled with literacy to a certain extent? And I know that there's certain parts of the country and clinics that I've worked in that some of these resources would be a little bit too much for my patient to understand. I think that's the biggest challenge that we face as primary care providers, period. And that is understanding how much our patient is really being able to absorb the information. So I appreciate that question, and I would say that there's plenty of resources, especially as we look at the references from this back, just looking at Know Your Dose, Get Relief Responsibly, and seeing, okay, I can go on these websites and I can look and see what's available for my patients, and then particularly depending on where you're working and the patient population. So thank you.
Thank you very much, Christine. And I also just want to let attendees know that the webinar was recorded and it will be posted to our website in a few days, so people will be able to view this again if they need to.
Excellent. And I really want to drive home the fact that you cannot underestimate how important this is. So, when we think about our value in primary care, it is really about gaining patients' trust and the value of healthcare to bring their symptoms under control and to educate them about their risks. And so I think this is the pivotal opportunity with something so basic as acetaminophen, but such an important part of our patients' lives. I was astounded to read that it is really 50 million Americans that are taking this, and we can't shy away from the value of this to our patients, and ultimately to bridge the gap, I think that's so evident in a lot of the publicity. So are there any other questions?
There haven't been any other questions posted. So with that, I'm going to thank you very much, Christine, for presenting this information.
Absolutely.
And thank everyone else for joining us, and I hope everyone has a great rest of the day.
Thank you. Thanks so much.
Thanks.